Have you ever wondered why elderly people over 60 often have cramps and weak legs without knowing the cause? We often hear someone recommend supplementing vitamin E or vitamin D to prevent aging and strengthen bones. However, sometimes the good vitamins accidentally harm the body. In today's video, we will learn about two types of vitamins that are easily misused, silently weakening the legs and causing cramps in the elderly at the same time. Looking at the common situation in notable numbers about this condition. Part 1. Vitamin E, miracle oil, or danger for the elderly. Vitamin E is often promoted as an antioxidant, helps beautify the skin, increases resistance. The elderly often use vitamin E to prevent aging, improve blood circulation, but be careful. Vitamin E is a fat-soluble vitamin, so if used in high doses continuously, it can easily accumulate in the body. Healthline.com. This can cause a series of health problems. The harmful mechanism of excess vitamin E is to thin the blood and inhibit the body's ability to clot. Healthline.com. In other words, high doses of vitamin E dilate blood vessels, preventing blood clots from forming normally. As a result, blood flows more easily after an injury. But in return, internal bleeding, severe bleeding, is more likely to occur. That is why some medical experts recommend that the elderly should not take high doses of vitamin E on their own, especially if they are taking anticoagulants or aspirin, because even 300 mg per day of vitamin E can increase the risk of bleeding. Vinmec.com. Healthline.com. Specific symptoms. When taking an overdose of vitamin E, users may experience symptoms such as fatigue, headache, nausea, vomiting, abdominal pain, diarrhea, poor appetite. Midlife.vn. In addition, excess vitamin E can cause weakness, dizziness, and fainting. Typically, after a period of overdose, the elderly may feel tired limbs, lack of flexibility, and even easy bruising or nosebleeds. Medical reports also show that prolonged use of high doses of vitamin E can cause cell damage, destroy the body's natural antioxidant mechanism, and even increase the risk of lung cancer. Medlitech.vn. Not to mention, using vitamin E with birth control pills or hormone drugs, estrogen, can also cause dangerous blood clots. Medlitech.vn. For example, Mr. Hung, 68 years old, is healthy but worried about the harmful effects of old age. So he listened to the advertisement and bought a pack of vitamin E to take one pill per day, about 200 milligrams. After a few months, his legs often hurt. He felt dizzy after sitting for a long time and standing up. And he also felt bruised easily even with a slight bump. It was not until he went to the doctor that he discovered that he had a vitamin K deficiency and poor blood circulation due to an overdose of vitamin E. Mr. Hung's condition shows that no matter how good it is, vitamin E is harmful when used incorrectly. Expert advice. According to Vinmec, the safest level of vitamin E is below 1.000 mg per day. And the elderly should be especially careful if they are taking anticoagulants, as even a dose of 300 to 500 mg can cause abnormal bleeding. Vinmec.com. Healthline.com. Nutritionists also remind that most elderly people get enough vitamin E through their diet, vegetable oils, nuts, etc., so they rarely need to take supplements. If you want to take more, you should consult your doctor, follow the recommended dose, and monitor your health regularly. Part 2. Vitamin D. Sunbathing must be done properly. Vitamin D is known as the sunshine vitamin, which helps strengthen bones, prevent osteoporosis, and support muscle function. It is true that the elderly are prone to vitamin D deficiency due to lack of sunlight and poor diet, so doctors often recommend supplementation. However, excess vitamin D is the cause of sudden muscle cramps and weakness. Why does excess vitamin D cause cramps? The secret lies in the fact that vitamin D increases the absorption of calcium and phosphorus from food. A sufficient amount will strengthen bones. But if overdosed, the blood will have excess calcium, hypercalcemia. When calcium in the blood is too high, the body's regulation of muscle contraction and relaxation is disrupted. Muscles are prone to stiffness causing cramps. Or conversely, muscles are weak and painful. The Cleveland Clinic, USA, notes that symptoms of hypercalcemia in adults may include muscle pain, muscle weakness, and cramps. To put it simply, Excess vitamin D causes calcium to stray away from the bones, causing the nerves and muscles to not function smoothly, leading to more frequent cramps and muscle tension. Interaction with minerals. When there is excess vitamin D, not only does blood calcium increase, but it also interacts adversely with other minerals. Excess calcium in the blood will combine with phosphate, forming crystals that deposit in soft tissue. This leads to soft tissue calcification. Calcium can be deposited in blood vessels, heart valves, kidneys, and even joints and tendons, impairing the function of related organs. For example, if calcium deposits too much in the kidneys, it will form kidney stones. And if it deposits in blood vessels, it will cause atherosclerosis, leading to heart attacks or strokes. In short, excess vitamin D is excess calcium, causing a series of serious problems for the elderly. Scientific evidence. Many medical studies have demonstrated the consequences of excessive vitamin D supplementation. For example, medical literature records a case of a patient taking 130.000 IU of vitamin D per day for several months, more than 30 times the safe limit, leading to poisoning, with symptoms of nausea, vomiting, weakness, and obvious muscle weakness. Another study shows that most of the harmful effects of excess vitamin D actually originate from hypercalcemia, causing kidney stones, bone pain, cardiovascular disorders, and especially muscle weakness and cramps. Nutrition experts warn. If using vitamin D, absolutely do not exceed 4.000 IU per day for adults without a doctor's prescription, because exceeding it will easily cause excess and cause cramps. Heart rhythm disorders. Part 3. Expert advice. How to use vitamins safely. After understanding the mechanisms and risks, it is time to find ways to avoid harm. First, older people should only take vitamin E or D when they really need it. For example, when a doctor determines that they are deficient, do not take it on your own based on advertising or word of mouth. If your doctor prescribes vitamin D, follow the correct dose, usually 600 to 800 IU per day for those over 60. Do not double or triple it yourself. And remember not to take high doses of vitamin E just to beautify the skin or improve strength. Experts also remind that if you are not deficient, you do not need to supplement too much. Warning signs. While taking vitamins, pay attention to strange symptoms. With vitamin E, if you experience easy bruising, nosebleeds, bleeding gums, unexplained fatigue, or persistent headaches, you should stop taking it and see a doctor. For vitamin D, if you have symptoms such as increased thirst, frequent urination, nausea, diarrhea, or especially more frequent muscle cramps, feeling tired and weak, you should stop immediately and check. The above signs can secretly indicate that your body is overloaded with calcium. Do not ignore them, because the longer you ignore them, the more severely your body will be affected. Blood test. When using vitamins for a long time or having unusual signs, ask your doctor for a blood test. This test will show the concentration of vitamin D through 2,5-OHD, vitamin E, as well as the calcium index in the blood. Usually, your doctor will order a vitamin D test if you take supplements of more than 1.000 IU per day for a long time, or have bone and joint diseases. The test results help determine whether you have excess or deficiency of any vitamins, so that you can make appropriate adjustments. The Medical Association advises against taking more than the recommended dose without testing, especially in special cases such as taking osteoporosis medication or anticoagulants. How to use safely. To be safe, prioritize vitamin supplements from natural foods instead of just taking pills. If you are prescribed medication or vitamin pills, you need to take the correct dose and for a short time. Usually, vitamin D or E supplements are best taken with meals to increase absorption. Fat-soluble vitamins are often better absorbed when eating fat. Before taking additional pills, it is best to consult a geriatrician or nutritionist. Experts share. Understand your diet. Only supplement if you are really deficient, and follow the recommended dosage. Part 4. Nutrient-rich foods instead of pills. It is best not to rely on pills when nature has given us many foods rich in vitamin D and E. Vitamin E is abundant in vegetable oils and seeds. Some suggestions: sunflower oil, olive oil, almonds, walnuts, cashews, Sunflower seeds are all rich in vitamin E. Green vegetables also have some vitamin E, for example, spinach, broccoli, tomatoes, mangoes and kiwis are also natural sources. Just add a few slices of avocado to your meals or have some almonds as a snack. You will have more vitamin E without worrying about overdose. For vitamin D, in addition to getting some sunlight every day, about 10 to 15 minutes before 8 a.m., you should eat fatty fish, salmon, mackerel, sardines, and eggs. Yolks all contain vitamin D. Mushrooms such as shiitake mushrooms and button mushrooms are also quite rich in vitamin D if exposed to the sun. In addition, many foods in supermarkets have been supplemented with vitamin D such as milk, soy milk, breakfast cereals, or orange juice. For example, a 100 grams serving of farmed salmon contains about 440 IU of vitamin D, meeting about 55% of daily needs. These natural sources help the body absorb vitamin D in a balanced way. Instead of taking pills, add fish, eggs, and vegetables to your daily menu to improve leg health without worrying about excess. In addition to vitamins D and E, the elderly also need to supplement enough calcium and magnesium through milk, sesame seeds, bananas, etc., to support muscle activity. If you eat a balanced diet of all the food groups, vegetables, fruits, protein, whole grains, then taking vitamin supplements is just a supplement. Doctors and experts always emphasize that fresh, nutritious food is the key to long-term health, better than eating too many supplements. After the age of 60, healthy legs are the key to maintaining an independent life, moving easily and enjoying the joy of gathering with children and grandchildren. Vitamin E or D both play a certain role, but taking without science can easily become a double-edged sword. Remember that pills cannot completely replace a healthy meal, and supplementation must be prescribed by a specialist. If you see strange signs in your legs, such as weakness, cramps or numbness, immediately think about the possibility of using vitamins incorrectly and see a doctor for timely examination. Finally, we hope the above information is useful for elderly families. If you find the video useful, don't forget to like, share with relatives and friends, and subscribe to the channel so you don't miss out on future videos sharing useful health knowledge. Wishing you good health, safe limbs and a happy life every